Hey, que Pasa Calexico? Welcome back to the podcast. Like always, before we begin, I want to thank a couple of people. I want to thank my anchor sponsors, Camilo, Jake. I also want to thank my new sponsor, Eddie Lopez from Roots Creative. Thank you for sponsoring the podcast. I also want to thank Dents on Border. If you have any dents or scratches on your car, make sure you contact Dents on Border. Look for them on Facebook. I also want to thank my friends at Sergio's Tacos and Hotdogs with 8 years of experience serving the Imperial, San Diego, and Yuma counties with Mexicali-style tacos and taquizas. Contact Sergio at 760-562-0057 or follow them on Facebook under Sergio's Tacos and Hotdogs. Also want to thank Dylan Castillo from Castillo Bookkeeping and David Castellum. If you're thinking of buying or selling a home in the Imperial or San Diego counties, make sure you contact David. He's not only a realtor, but an investor with over 20 years of experience, and he'll teach you along the way in one of the most important investments of your life. His phone number is 760-235-9576, or look for him on Facebook, David Castellum. All right, guys. Well, today we have a really special guest. I've been following her for a while now on Instagram. I guess since she went on Instagram with her page because it popped out on my people you might know or suggestions. And I was like interested on what she was doing because it's really helpful right now in these times, putting out really good information about, the medical field and it's good to hear from somebody that's been in the field for a long time. My guest today is Nurse Amy Corrales. Is your last name, I believe?
Yes.
Yes. Thank you for being here.
Thank you for inviting me. I feel very excited to be here. Thank you.
Before we begin into, going into your Instagram and what you're planning to do and the things you're doing now, can you tell us a little bit about yourself?
Sure. So again, my name is Amy Corrales. I am born and raised, born in Mexicali. I moved here when I was 12. So I kind of embraced Imperial County as my real hometown. I've been here more than half my life. So I really love this community. I went to school here. I went to Calipatra High School. I graduated top 15. So I always like to brag a little bit about that. But I did graduate with a class of 99 students. So do your math. But very proud. I do love our little town in Calipat. And then right after high school, I went to IBC. So I'm a former student of the Imperial Valley College. I took 2 years of my prerequisites. And then I went into the nursing program. And back in 2001, it wasn't as competitive because I got in right away, which was a blessing, and completed my entire education in 4 years. I graduated in 2003. And before I even graduated as a nurse, I had a job at El Centro Regional Medical Center offered to me. So it all just felt like a blessing. Everything just snowballed very organically. And I'm here now, 18 years later. Still a nurse.
What made you go into nursing?
That's an interesting question. Thank you. And that is really, it happened in, I want to say 1996-ish. I was 16 years old, and I had an aunt that was paralyzed from neck down that needed total care. And I went and spent a summer, and I helped my cousin take care of her. We did bed baths. We helped her, feed her, give her medications, and also do other personal care on her. And it made me feel so good. Then I thought, how can I expand this into like my future career? How do I go about this? So when I came back, I had really awesome counselors, and I don't remember her name, but I walked into her office and I said, hey, I really would like to know. I know I'm about to finish all my credits in my senior year, and is there any way that I can join the IBROP program? I heard that they have a certified nursing assistant program, and I'm would like to join. And she said, you definitely can do it. You're done with your credits, have your senior year, you have it open. You can do this. And that's how I got started, honestly, through the IBROP program. And just being in the medical setting and seeing the nurses, the doctors, the interactions, the environment inspired me to continue, with that goal.
So
That's how I got started.
you said you worked at El Centro Regional Medical for how long?
I did. So I graduated in 2003 as a nurse. I took my California Board of Nursing exam and passed it on the first time. Like I said, during my clinical hours in the nursing program, we used to spend some of those clinical hours at El Centro Regional. And through working and collaborating with the nurses and having that exposure, someone saw me and said, hey, we'd be interested if, I knew when you're done, you have a job. And so I started in 2003 as a certified nursing assistant. That's how I got through the door. And as soon as I passed my test, I was working on the medical surgical unit, and that was in 2004. So from 2004 till 2010. So I did a little bit of everything in that hospital.
Wow, that's crazy. So, you haven't been in the nursing field for a while, or how long has it been that you haven't been actually in a hospital setting?
Sure. So right after 2010, like I mentioned, I was there from 04 to 10, and I worked in medical surgical unit, ICU. I did dialysis, which is a specialty unit in the nursing world. Once I left the hospital, I did a little bit of home health. I worked at a eye clinic here, very famous eye clinic in El Centro with Dr. Mani. And I also did, I did infusions for him. So I was doing testing and infusions for about 2 years. But after that, I did acute, at the hospital, I had done acute hemodialysis, like I mentioned. But then I worked at the outpatient clinic, and I was doing dialysis there for about a year. So it's been about now 6 years. I did decide to go into a different area of nursing.
And what area is that?
So I currently work for a managed health organization. So our biggest population is Medi-Cal members. And I work in the quality department as a senior quality improvement specialist, and it's a clinical role. So, I'm directly in touch with doctors and their staff, as well as clinic systems. So I do a lot of education and process improvement, as well as performance improvement initiatives. So more of the business side of nursing.
And what made you decide to go from, the actual nursing part of the nursing field to patient care to the admin or the business part?
Right. So about 6 years ago, I think it was 2014, I was really looking to be have more of a set scheduled. I am a mom of 2 boys, and at the time I was mom of 1, and I wanted to give more time to my son. So I wanted to look for something that was not long hours, long shifts. I was used to working 12 to 16 hours a day, and being a mom was more of a priority. So I decided to explore that area of the business side.
Yeah, I think that's something that that when I speak to friends that are nurses, it's one of the things that, you won't see them for a while because they're working 16, 12 hours, but they'll have 3-4 days off. But sometimes those days off aren't, your days off. So you can't really get together because, can't get together right now, period. But back then when we were normal, we could get together. Our schedules wouldn't match, but yeah, I know that nurses have really, really crazy hours, and I imagine even now with having ICUs full and COVID patients and all this, going into how I found about you, it was through Instagram. What made you decide to create your Instagram page?
Right. I have been on Instagram for several years now. I do have a personal page that I normally post about my family, about fitness. And so that's kind of how I got started initially. And I think that space is very positive. So I have really enjoyed it. Through the pandemic, so we went from many of us hundreds, if not thousands, went from working out in an office to going into their home and spending the majority of our time there. So I basically work from home Monday to Friday, and I kind of lost connection with people. I love networking. I love building relationships, especially in my professional area, but also personal. So really being limited to staying home kind of inspired me to start a second Instagram. And that Instagram, I wanted it to be very special. I wanted it to be all about healthcare, and that I wanted to be a platform where I can share education with my community. Like I said, I've embraced Imperial County as I was born and raised here 100%. And I know that education and awareness is very much needed, especially when we are confined to our homes and not getting out there and being exposed to more education. So that's how it started.
Yeah,
and it's only been a month and a half. So
yeah, it's fairly new, and but like some of the things that you've shared, kind of like hit that spot for me. When I think one of the ones that you were, the one that really caught my eye was when you did the video on the advanced directive form. I think that a lot of people, I mean, at least, what is it, like 500 and something people, families here in Imperial Valley have lost a family member due to COVID. And I feel that a lot of the people that, have died from COVID were in there alone. The family couldn't go visit or make decisions, or, I mean, maybe they could, but most of the people that went into the ICU or got into respirators was like really fast thing that happened. And people don't think of, what's going to happen. Am I going to, make it out or whatnot? So like when I saw that, I was like, man, it's really important for people to know about this form and how to fill it out and all these things. Can you talk a little bit about that form?
Yeah, sure. I just want to tell you a little bit of background why I think this topic is so important to all of us. There's no one here that, if you're not of age 18 and older and not interested in having an advanced directive, listen to this, because my first experience with death was really at me as a nurse. And I had a patient that had an order for do not resuscitate. And basically what that means is that this particular individual decided to have an advanced directive and really notate and delineate all of his wishes at end of life. And so this person decided that he no longer wanted to have CPR, no longer wanted his heart to be restarted, didn't want to have any over the top, care to sustain his life. And I thought that was very brave. But me as a new nurse, I wanted to save his life. But I want our community to know that they have a choice and that there is a document that's a legal document that they can get notarized and really just list the things that they're willing to go through at end of life, or if there's a situation where they can no longer speak for themselves, that they really list what they want done or not. Do you want to continue life support? Do you not want to continue life support? And so forth. Do you want to be comfortable and get pain medication, even if that means that you'll lose your life? I think that's important to have recorded in a document, so that not only do you have a choice of what's going to happen when you don't know and can't speak, but also give comfort to that particular person that will have power of attorney to make the decision for you, make it easier for them, and not place them in a place where I didn't know what she or he wanted. So that form I actually had multiple people reached out and asked me for the form. So I sent several emails. That form is really almost like maybe a 2-pager that you can complete. It's you can find it online. Your provider has it available for you. So when you go to your primary care physician, you can ask for an advanced directive form. You can have a discussion with your provider, and they can really explain, how to fill it out. If you're unable to, it's in English and Spanish and any other, other languages. But when you go to your primary care physician, they have it. And that's how I got it, actually. I wanted to see what the process was. And I got, got in the car through the pandemic and walked over to my doctor's office. And I said, "Do you have the advance directive?" They were so kind, gave it to me. They wanted to explain how to fill it out, but I know how. So it can be a very easy process. So I encouraged everyone of the age of 18 to look into it.
Yeah, and I remember when my father-in-law passed away, he had left one of those for my wife, and yeah, he left in really specific directions of, you know, if he was in that situation, you know, he basically stated, you know, what was going to be his quality of life if you know, if he reached that point, and if he could be resuscitated, what was going to be his quality of life, and that was like what he based his choice on. And like you said, it's really important for people to sit down and talk about it, because it gives the person making that decision, you know, peace of mind of you know, when they're going to make the decision, you know, they talked about it, and it was a discussion that was had with the person that you're making the decision for. And yeah, I feel it's really, you know, that's something, like I said, it's something that really caught my eye when you were talking about it. And it's, especially, like I said, right now that we're going through these times that, you know, people are losing their lives a lot, especially due to COVID. And like you said, like I said, you know, with COVID, like, you don't know, like, you could be fine one day and the next day, like, really, really sick, and you go into ICU, and like, you don't know what's going to happen.
Exactly. I think we live in unprecedented times, very unique times. And especially with COVID, I think it inspired me to think about those people that perhaps didn't have any chronic conditions, and they got COVID and passed away. I have several friends that have had COVID, and they're okay. And I'm, you know, very, very glad that they were able to get through that. But I also know of friends that have lost their parents due to COVID. And that's unexpected, right? So this pandemic drops on us, and we can die tomorrow, but we need to be prepared, especially now, because we don't know what could happen.
Yeah.
So.
Yeah. And it's crazy because, you know, it's something that I guess, like, we really didn't think about till, you know, we're in a situation with COVID, because like it's you know, it's real. There's so many unknowns with COVID that it's making us, you know, think more of what if
Planning.
Yeah. And talking about COVID, you know, you've been talking about also on your Instagram about, you know, COVID stigma. A lot of people have gotten COVID, and people are kind of like, oh, you had COVID, or you have COVID, like, stay away from me. Like, what's your advice when it comes to, you know, that subject?
Yeah, first of all, there is a stigma with many things already, but going through the pandemic, for many of us, you know, if not millions of us in the nationwide, have suffered from some type of mental health due to the pandemic, whether that's anxiety, depression. So when I kind of came across certain conversations with friends and family, like I mentioned before, I had several friends that had COVID, and they kind of isolated themselves, you know, and people tend to isolate. And I'm not going to say everyone, but people may tend to isolate because of, you know, feeling embarrassed, or feeling like, did I do this to myself? Did I do something wrong? Did I not wear my mask properly? I thought I was following the precautions. How did I get it? And will other people be afraid to be around me? So they automatically just withdrawn. But we have to tear that stigma down. It's like any other virus that you could have had. You had it, you recovered, and you keep going, and you keep taking those precautions. The universal precautions are going to be around for a while. I keep telling friends and family and Instagram, that's my main platform, that even when we get our vaccines, we need to continue to use our protective equipment. And that means, you know, our mask, social distancing as much as possible. Sometimes it's a little hard. You know, you stand in a line at the grocery store, you kind of forget that you're too close. But always being mindful of others, and hand washing is 100% important.
Yeah.
But yeah.
Go ahead.
Go ahead.
Oh, I was going to say that, you know, before COVID, we would see, people from other countries, specifically like Asia, like people were, they're used to wearing masks. Like whenever they have a cold or something, they'll wear a mask, and sometimes they do it to protect themselves from other people, but sometimes it's to protect others from themselves. And I feel that, I'm hoping that, with this experience we're going through, I'm hoping that, it becomes more of a thing here in the United States, where if we feel sick, we have a cold or the flu, we would, if we need to go outside or be around people, we wear a mask, and I feel I'm a little bit hopeful that, there's a lot, when you go to like Old Navy or Gap, you're starting to see, them selling masks as a, like you see them everywhere. So hopefully I'm hoping that, that becomes a thing, a trend where like, yeah, we're going to keep doing it even after this. I'm sure like you're going to see me in the future after this, with a mask. If I feel sick, I'm going to be wearing a mask, because it's just being thoughtful of others, and it's, I hope it becomes a thing and it's not, stigmatized, because at the end of the day, like, we're just being, we're, like I said, for me, it would be, I'm being thoughtful of others around me so I don't get them sick.
Yeah. Well, many of us, you got to think that, again, we've never gone through a pandemic, and to be told that you need to wear a mask at all times when you're in public settings or with people outside of your bubble, per se, your immediate family, can be hard for some. A lot of us that are professional healthcare professionals, that is something that we do on a maybe daily basis when we work in a hospital setting, when we work in a clinic, that we got to take precautions. And there's universal precautions that we learned through our career, through our education. That's whether that's wearing a mask, gloves, to protecting you from touching any body fluids that might contain bacteria or viruses. So we're always protecting ourselves, and we're used to it, but it's understandable that some would feel uncomfortable to be told, even when you're pumping gas at, Costco here, that you need to wear your mask, right? But it's been a year, a little bit over, maybe close to a year since the pandemic. And this should be like an automatic thing that we do already, okay? And like you said, if we're feeling healthy and we're feeling, free of any disease, or we're not currently suffering from COVID, you still want to wear that mask and protect others, because you might be asymptomatic, meaning that you don't have the symptoms, you feel well, but you might be a carrier and passing it on to others. Your child, perhaps, your child that goes to daycare can take it on and pass it on to daycare, little friends and teachers. So continuing to wear your mask and hand washing is absolutely important. I can't emphasize that enough.
Yeah. And it's crazy because right now that you mentioned, daycare, and then I was just thinking in my head, like, the daycare, and then the kids pass it to their parents, and then and something that I think it's been harder for, at least in my case, for my parents, my uncles and aunts that are used to getting together like on the weekends. So it's I'm a homebody, so like I do miss hanging out with my friends, but I'm kind of like a little bit okay with being at home. But for them, like, I know, like, I've been struggling, trying to keep them at home. And yeah, my wife had to talk with my mom, where it's like, she's like, okay, just stop and think, you go and visit the cuñadas, right? And you guys are playing cards. So your cuñadas saw their kids yesterday, and then their kids saw, just think about how many people without you actually being in contact with, you were in contact with. And mom was like, oh crap, that's right. And my mom's not that old, but my dad's a little bit older. So, and we're told, like, yeah, it's good that my dad's staying home, but if you get COVID, you're gonna go home to my dad and give it to him, and you could be asymptomatic. So we're like, you need to stay home. But luckily, she got the vaccine because she takes care of my nephew. But still, like, it's other thing. Like, people that are getting the vaccine are a little bit comfortable, or they're going out, but you can still, they don't know if you could have the vaccine and not get symptoms, but you still have the virus. So like, that's the other reason why people need to still take precautions even after having the vaccine.
Right. So a lot more people need to be vaccinated to be able to reach that herd immunity. And like to just touch on your point, you might be very comfortable after you get the vaccine and feel like you're invincible and can go out to hang out with more family, friends, but nothing really changes, like I mentioned before. Even when you get your second dose, you have the Pfizer vaccine and the Moderna. They both require 2 doses, weeks after you receive the first one. You still continue, and you can find those guidelines on the CDC website. But you continue to protect yourself and protect others. It's funny that you mentioned that, like, it only takes one person, right? So I myself am a homebody. I work from home, stay home, work out in my garage gym, and I try to not go out as much as I can. I try to utilize my resources in the community. Like Walmart is a perfect example. They do pickup, so I love using pickup. I just order my groceries online and minimize the risk. You won't find me at the mall shopping every weekend. So you got to do your part, in all of this, and just try to stay home and do the best you can. I think one advice I would give my community is to really think about health promotion and prevention. So not to wait until you're sick, right? To seek the doctor. And not only when you have an emergency, you go to the emergency room or the urgent care, but start thinking proactively about yourself. And that means taking care of your body, your mental health, your physical health. And this is a perfect example of how this virus is affecting people with chronic illnesses, and our elderly. Elderly have a dear place in my heart. And those are the most vulnerable populations that COVID is affecting. So to me, I keep pushing. I keep pushing for my community, one person at a time, to start establishing care with their primary care physician and kind of go down an assessment and screening of possible problems that you can be encountering and that you might not even know about. So it's so important to establish care with a primary care physician.
Yeah, and I'm a like a how would I say this? Somebody that I'm fairly young. I'm 38, be 39 soon. But like for me, I went to the doctor because I was snoring a lot and it was waking my wife up. So I went to go to get a sleep study. So I was there because I was trying to see if I had sleep apnea or not. So while I was there, like every time I went for just like to checkups or whatever, they would always tell me like, hey, did you run here or did you drink coffee or an energy drink? I'm like, no, why? Like, because your blood pressure is like really high. And I think it's a lot due to our culture where we're not used to like going to the doctor on a yearly basis. Having a yearly checkup is really something that I recommend people do, because I've been doing it like these last couple of years. And it's because of that, because they found out that going to the sleep doctor for a sleep date, like to get a sleep study, they found out that my blood pressure was always high. So I went to my primary care and it's like, oh yeah, you have, you're borderline, what's it called? I don't know, but it's something with my blood pressure, right? I'm borderline. So like I was able to take care of that. So now like my blood pressure is, better than it was before. So yeah, like, do you think that, our culture, Mexicans, Hispanics are more, they're somebody that doesn't tend to go to the doctor and get like regular checkups?
Funny that you ask. So I actually work with that population. I work for the emergency department diversion program. So my duty at the time, that was back in 2015, was to, through case management, telephonic case management, I made hundreds of calls to members of my company that were going to the emergency room frequently. And my goal was to identify those barriers of why they were choosing to go to the emergency room versus going to their primary care physician. So I did a lot of outreach, and what I gathered is exactly what you're saying. Our population, our culture is, if I don't feel sick, why go to the doctor? ¿Para qué voy? Estoy bien, no pasa nada. Mi mamá nunca fue, mi papá nunca fue, right? So, and the same thing I would get from hundreds of men and women of different ages saying, well, I didn't think I needed to go to the doctor. It's easier to go to the emergency room. It's faster, and I'm in and I'm out. But that's the same thing goes with primary care physicians. You make your appointment, you have it set, you go in and you get out. Now, I am very mindful and I'm very realistic that because our county has limited resources, we might tend to wait a little longer than we would like at a doctor's office because we have congested, waiting areas. And it just depends on the practice. They might have better workflows where they get their patients in and they get them out quicker than others. It just depends on the resources and the workflows, the processes at each individual doctor's office or clinic. So we do hear, well, when I go to this clinic, I wait 2 hours, and people don't want to waste that time. And I think they shouldn't. They shouldn't wait that long to see their doctor when they have made an appointment. But it's definitely easier. The mentality is that if you go to the emergency room, you take care of that problem then, and then you don't have to go back in a year.
Yeah.
But yeah, our culture is very like, no, I don't need to take medication. I don't want to know. I don't want labs done, because if you do labs, I might know something that I don't want to, and I'm not prepared.
Yeah, I think my mom once said that. She's like, no, ¿pa qué voy? Like, si me voy a morir, I'm like, dude, like, are you serious? And my mom's not even that old. Like, let's see. She's just like mid-50s, I think. Like 57 or something. So, and then she's like, no voy a ir porque me van a decir que tengo algo y no quiero saber. I'm like, but yeah. And yeah, like I said, I learned the hard way that it's important for you to do like at least a yearly checkup. And from the and most of the times, like from there, they'll say like, you know what, come back in 6 months or come back in this amount of time if they see any. Yeah.
And it really depends on the individual. It's on a per cases basis. Not everyone has to go every 6 months or every 3 months. It just depends on your level of health. If it's actually recommended, and there's different guidelines, pediatric association, and we have that from birth till end of life, you have an annual checkup with your primary care physician. Now, as you get older, and don't get me wrong, you will have pediatrics, children and adolescents that are suffering from chronic illnesses like juvenile diabetes, type 1 diabetes. But when you catch something early on, you're better equipped to start learning about the disease and start getting the tools that you need to manage that in the long term. If you wait until you're 18 to realize I've had diabetes my whole life, and this is why I feel sick all the time, I miss school, all these things, then the damage has already been done to your body. And as you get older, we have those in our culture that they never went to the doctor, right? And they waited until their 40s, 50s to find out I'm a diabetic. And now my kidneys are failing. They're not filtering my blood as well as I did before. I'm not urinating as much anymore, so I'm building all this fluid in my body. And you might require dialysis. So I'm talking about extremes here, but the point here is to get in there and kind of do a tune-up of your body, like find out what's going on and don't be afraid. They're there. The professionals are there to help you. I was once a direct patient care, and I, like many other nurses, I share the same sentiment. We're there to help. And we're there to educate you, but also I want to put the accountability on the other end of my community and individuals that you need to do your research. You need to listen and you need to ask questions when you go to the doctor. It's your body, and if you don't care, who else will?
Yeah. And I hope that, this experience we're going through with COVID, knowing that people with diabetes, high blood pressure, all these what is it called? Morbidity, like morbidities or, other
additional illnesses, diseases.
I hope that, this experience we're going through will open people's eyes in the sense that, it'll make them, go to the doctor and see if they're suffering from any of these diseases, because, hopefully we don't have to go through this in the near future again. But if you're healthy enough and if your immune system is strong enough, you'll be more prone to survive these kinds of things that were like, the COVID or any other airborne diseases that we might face in the future. Making sure that our bodies are, not 100%, but like at least somewhere up there that, will help us live a longer, better life and live through these kinds of things that we're going through. Also, I wanted to talk about, some of the things that, you as a female, you guys have to, and males too as well, but females, you guys have to check for breast cancer and all these other, things that go in the female body. Can you talk about the, what is it, cervical cancer awareness?
Cervical cancer. Yes. So a lot of, like the top two cancers for women are breast cancer and cervical cancer screening. So I've been doing a lot of education on my Instagram because it is Cervical Cancer Awareness Month on different, areas of cervical cancer, whether that's signs and symptoms, whether that is the type of treatments, or actually what the screenings that are required to kind of detect that cancer on your cervix. I'm doing all of that education on the Instagram and posting like very graphic pictures that perhaps you've never seen, but kind of explaining the process of this is what it looks like when they're conducting a Pap smear to detect cervical cancer. And all it takes is a Pap smear, and it's a not even 5-minute procedure that can save your life. So I'm really big on that right now this month. And coming October, it'll be Breast Cancer Awareness Month. But any day, any month is cervical cancer screening, and as well as breast cancer screening. And if you're of the age of 40 and older for breast cancer screening, is recommended that you have a mammogram. So I think I do a lot of, I'm very passionate about, like I mentioned, health promotion and kind of educating anyone that I come across, with that there is preventive measures. So detecting before it's too late.
And going back to like our culture, I feel like not a lot, like I don't ever remember my mom telling my sister, hey, let's go take you to the doctor so you can get, all these checkups that women have to go through, right? And a lot of the times, if you don't have that, person like a mom or an aunt or sister that's encouraged you to do these things, it could be a little bit uncomfortable because, you're dealing with, female parts, and a lot of times it's a male doctor that's checking you. What kind of advice do you give to other females that might be a little bit embarrassed to, go out and have a doctor, touch them to make sure that.
Sure. In our culture, as you know, we really listen to our parents, right? Or we try to. And so especially if you're under your parents' insurance, you're kind of maybe tending to ask, hey, mom, dad, I need to have this done. Can I kind of asking for permission because you are under their benefits. But you have the right to go see the doctor if you're 18 years or older, and kind of have that privacy to talk to your doctor and get treatments that you normally perhaps wouldn't do in front of your parents. If you're still living at home, or if you're not living at home, and then you're a female, a lot of our culture, females might feel like having a male provider to do some of these screenings could be uncomfortable. So you can ask for a female nurse practitioner, for example, or a female doctor to perform a Pap smear, where you kind of have to be vulnerable to expose yourself, your privates, to have the screening. So it can be uncomfortable, but there's ways to navigate, and so that you can get the proper care that you need. As well, for a breast cancer, there's female technicians that can perform a mammogram and be very gentle, and you can feel comfortable doing that. But breast cancers are more for again, our older population, but screenings, Pap smears can be done as early as 21 years of age.
Mm-hmm. Yeah, because I mean, it's important for you to check yourself if you feel something that.
If you feel anything that's abnormal, like cervical cancer screening can be an ongoing pain on your pelvic area or abnormal bleeding, get it checked out. It's it can be worse. It can be you can lose your whole uterus and lose a chance to give birth. So I think doing a quick 5-minute screening where they they actually scrub your cervix with a little swab and a brush. It only takes 5 minutes to detect early signs of cancer or advanced stages as well.
So I want to talk about some of your future plans for your Instagram. I know that you have one episode of Chats with Amy.
You do.
what do you feel embarrassed, or was like?
Like I mentioned, the Instagram is only been around for a month and a half, and I've had such an overwhelming amount of support. Not only like people reaching out like through direct messages to ask me questions, guidance, or how to navigate certain areas in healthcare, but just to ask my like honest opinion and other different awesome opportunities as well. The Chat with Nurse Amy really kind of snowballed from having a conversation with Tara Malcolm. And Tara Malcolm is a liaison at Hospice of Imperial Valley. Her and I go way back working with providers and kind of working in that quality initiatives and activities to improve processes at doctor's office. Her and I worked for about 2-3 years together, and we came across again through Instagram because, again, we're doing social distancing and not hanging out with our friends. So through social media, we connected, and we kind of, had a conversation, and we both thought, you're talking about advanced directives and end of life, care. I do hospice. I am a liaison for our community. I would love to come and speak with you regarding what those services are and kind of talking about the difference between hospice and palliative care. And I thought that would be amazing because all I want, my passion is to get information out there, education. People are on Facebook, on Instagram, they're watching, and I rather them learn how to take care of themselves than watch anything else. But we all have our preferences. So Tara was really amazing, and we just went for it. I came up with the name Chat with Nurse Amy because I wanted it to be something very casual, a comfortable conversation. And we're sitting together. And from now on, I'm going to do more episodes, but they're going to be probably like this through Zoom. So yeah, it's fairly new, and I'm on YouTube. So if you want to go follow me on Instagram, I'm as nurse_ Amy C. And on YouTube, you can type in Chat with Nurse Amy, and you can find the episodes there. There's different clips as well. And I started a blog within YouTube. So I'm going to be talking about my beginnings as a nurse. And this is kind of to inspire other women that everything is possible. I am also big on woman empowerment, and my story is very interesting, and I like to share with others.
And I'll put like on the description of this episode, I'll put links to your Instagram and your YouTube, so people can go follow and check out the videos on your YouTube. So something that I really wanted to ask you was about scams. You have something on your Instagram about scamming, especially right now with the COVID vaccine. What can you tell us about COVID vaccine scams and what people should know about it?
Sure. I try to talk about different topics in my Instagram. Like I mentioned before, I am just broad, wide spectrum of, we're talking about health prevention to, we might be talking about cervical cancer screening to COVID scams. So last week I was talking about vaccine tourism and the phenomenon of people traveling to different states, counties, and even countries to get the vaccine. Now, we know that that's not equitable because not everyone has the means to travel and to pay for a hotel and dinners and breakfast, all of these things that come with traveling. So people are willing to pay money to get the vaccine. And then from that, I started thinking and started doing research, and we get scams all the time. We get phone calls, we get emails that look fishy, that we shouldn't be clicking on links. We know this information, but I wanted to make sure that I put that information out there on vaccine scams because the vaccine is free. Okay, so the federal government, they're funding for millions of people to get that vaccine. No one's charging you. You shouldn't get any unexpected bills or statements saying that you need to pay for the vaccine. So I just wanted to make sure that my community knows that this is free, not to accept promises via phone calls or emails that if they pay an amount, they'll get the vaccine. Even if you feel desperate to get it, you will get it eventually. Just wait your turn and don't give in to that.
Yeah, and I feel that people that do these scams, that people are really vulnerable and desperate to get a vaccine, so that they take advantage of this situation. And like you said, like it's really important to know that the vaccine is free. As of right now, the vaccine is free anywhere that's gonna offer it to you, it's free of charge. So don't believe the bills or phone calls or creditors that are calling you because of you had the vaccine. That's all fake. So don't if you hear them, like say hang up or just throw away the letter, whatever you get in the mail. But yeah, it's really important that people know that. Is there anything that you would like to add? That any closing thoughts?
Yeah, I'm not. First of all, thank you for offering to invite me to your space. I mentioned at the beginning, before we started the podcast, that I'm very impressed. You're very diverse with the people that you invite into your space and very inclusive. And because of our conversations, I understand a little bit more of why you're so inclusive. So I really admire that about you. And I really want to tell my community to please come and follow me. I want to continue to be that support for you. I want you to learn how to take care of yourself, how to navigate the healthcare system. And I want to network with others in our community to empower each other and try to find out ways to collaborate so that we can bring more education and awareness to our community and stick together through these tough times.
Yeah, for sure. And that's, that's one of the biggest, reasons why, I wanted to have you on was because I feel that, the medical field, like for patients, it's really scary to, go to the doctor, ask questions, fill out paperwork, billing. I think a lot of people are also not only afraid of being told that they're sick, but just like billing, like getting bills of, maybe they don't really know what their insurance covers or what doctor your insurance covers. So I'm like you said, you've only been on Instagram for a month, but I'm sure at some point, you'll kind of like touch on these topics. But hopefully that, people can follow from, right now since the beginning and get to learn and maybe ask questions and maybe give you more topics as to what they want to learn.
Absolutely.
But yeah, I feel that, it's really important, especially right now we're going through these times, but in general, when you feel like you have somebody to talk to, somebody to reach out and ask questions, you feel more comfortable going to the doctor, asking those questions and making sure that, you're healthy. And even though you might feel healthy, just go and check yourself. Like you said, like do a tune-up.
Yeah, no, actually people are afraid, there is fear, just in general, going to the doctor and, not knowing. So the unexpected brings out fear. And when they're taking your blood pressure, it could be high. So it's recommended to wait and take a second time blood pressure to see if it goes down, because there is an anxiety disorder that they called white coat hypertension. So you're coming in like rushing, excited or nervous to see the doctor, and your blood pressure just like goes up. So we know that, we understand that, and so there is recommended that they take a second blood pressure at the end of the appointment to see if it goes down, and sometimes it does.
Yeah, and I remember like to me like they'll do like 2 or 3 times because they're like, are you nervous? I'm like, well, maybe a little bit, even though I wasn't, but I was just like trying to like justify the fact why my blood pressure was high. But yeah, and it was that, and you said the word that I was trying to look for, hypertension. I was like borderline hypertension. So yeah, like to me, like I was trying to justify, it's like, yeah, I'm a little bit nervous. And then they would take it again, and it might've been a little bit lower, but it was still high. So yeah, I think it's important for us to, accept the fact that, for us, Hispanics, Mexicans, we're prone for diabetes, high blood pressure, hypertension. So, it's something that even though we feel okay, we need to, check on it. If it's not a yearly, like a little bit more regular, because you don't want to get, like you said, like get older and then, have kidney failure or your heart's way too stressed, and, catch it early so that you can, live a longer, prosperous, life and healthier life.
Yeah, and so the whole purpose behind prevention is so that you have a better quality of life, and you get to live 70 to 80 years old and in good condition and with a good energy, and still be around to see your family grow, and do the things that you love. So better outcomes, health outcomes, and I'm here to help as much as I can in the community. And I'm also Spanish speaking, so if anyone wants to reach out and like share a topic that they would want to for me to discuss on my Instagram or chat with Nurse Amy, please do so. I can do it in Spanish as well. So it's a benefit of being a bilingual nurse.
Yeah, before we go, something that when I reached out to you on Instagram, and you told me, I asked you, are you still a nurse or you're no longer a nurse? You told me a nurse is always a nurse. Like, what's the meaning behind that, your answer?
It can go in different ways, but I have been asked several times, well, you're no longer taking care of patients, you're not a nurse. But I always respond with a nurse is always a nurse. And to some degree, just on the work that I'm doing now, I am supporting different counties at the state level to improve health outcomes, whether that's breast cancer, well care visits for adolescents and children, to immunizations, improving immunizations for kids in Los Angeles, just different projects that I'm doing. That is public health improvement. That is population health. And I have the knowledge. I've been in and at the bottom, at the front line for many years. So I have that experience. And as long as I keep, renewing my license, I will always be a nurse. And that's where that comes from. And
even, as a parent, you're a nurse to your kids, so even like people that aren't really nurses, like when your kids get sick, like you're on them like 24/7, like trying to get them better.
I'll say that it comes with its advantages. I have 2 boys, and the oldest is 11 this year. I never took him to the ER, even in the hardest moments. He suffered from asthma when he was a baby, and there were nights where I was just a hawk and taking care of him. So it comes with its benefits. I saved money because it can get expensive, going to see the emergency room. So I don't recommend the emergency room. I think I did one of my first clips was on to ER or not to ER. And I talk about, the differences of when to go and not to go.
Cool. Well, Amy, thank you once again for taking this time. Don't hang up when we're done, but
Sure.
Thank you again for taking the time. I want to make sure that everybody follows Nurse Amy. Like I said, I'll put her link on the description of the podcast. Really good information, and it's it's good information. It comes from somebody that has experience, and that's something that we all need right now. Really good information from a good source. So make sure to go follow her on Instagram and YouTube. And thank you guys for listening and watching, and stay safe. Wear your face mask, wash your hands, social distance, and we'll see you guys in the next one. Peace.